there, my name is Dethi. I'm here at the Digital Health Summit Studio live at CES. I have with me Terry Bradwell with AARP. He is the Chief Enterprise Strategy and Innovation Officer. Love that name. And we're actually going to talk today a little bit about caregiving for Alzheimer's, correct? So AARP is an organization that I have to say I'm a member of. So there you go.
Awesome.
I'm hoping and praying I do not get Alzheimer's.
Yeah, exactly.
So tell me a little bit about what AARP is doing to address the caregiving issues that are starting to really happen as more and more Americans age with Alzheimer's.
Yeah. You know, our focus, of course, today was on Alzheimer's, but at AARP, we call this really the decade of the caregiver. You know, caregiving is one of those type of issues that we have in this country that it's very, very fragmented. Solutions are very, very unintegrated. It's just a challenge for most people who get into the caregiving continuum. So one of the things that we have totally focused on at AARP is really the journey of the caregiver. And so today the panel, of course, was on Alzheimer's. So my perspective on it was really, what about those caregivers? So it's caring for someone with Alzheimer's and the journey that they go on.
And most often, I'm assuming, right, because I'm 50, my parents are of sound mind, but that could change, I hope not. But most caregivers are over 50 today.
Absolutely. Well, a lot of caregivers are over 50, but you know, the average caregiver is probably in the late 40s and usually is a female, the firstborn in the family, and that's the average profile of a caregiver.
Or in my case, the only female born in the family.
There you go. And that's one of the reasons I actually came to AARP. I found myself in a caregiving situation very, very early on, and I found this wonderful and amazing organization that just had tremendous resources around caregiving, and it just changed my life quite a bit.
So if you were to hope that we could change one thing in how we treat caregivers today and resources that we have available for them, what would that be?
Yeah, I think, you know, for me, it's there's a plethora of technologies that are out there. Technology is not the problem, but I think the problem that we have is really the integration of technologies. I mean, we all are carrying around our smart devices, smartphones, but typically they have 50 different applications on it. When you're looking at the caregiver's journey, it is one holistic journey. So if there was one thing that I would look at the industry to do more of, is to have more integrated solutions that will help the caregiver, from not only just monitoring technologies and things of that nature to give them peace of mind with their loved one that they're taking care of, but when you think about a caregiver, if you're dealing with someone, especially like with Alzheimer's, chronic condition, that's 24/7 care if you decide to care for that family member at home. So having those type of things that also, this is something that I hear all the time when I fly. When you fly, first thing they tell you, make sure you put your mask on first before you're able to help someone else. And that's what we need to do for the caregiver, because they're ones, you know, spending a lot of time, a lot of effort, a lot of resources, and also financially it becomes a burden for them as well. And so I would love to give sort of that surround sound to the caregiver in a much more integrated fashion to the type of, you know, solutions that was going to help them keep connected, you know, to their lives as well, and keep them healthy so they can care for their loved ones.
Wonderful. Well, thank you very much. This is Dethi. Thank you for visiting us at the Digital Health Summit Live Studio. Terry, we appreciate you coming. Thank you.
Absolutely. Thank you.